is an urgent call to action to all international organizations. The conflict in Sudan has created a dire humanitarian crisis in South Sudan. Nearly 680,000 refugees face severe shortages of essentials. MSF urgently needs international support to provide food, water, shelter, and medical care. Please watch the full interview and assist where possible.
More than 30,000 people chose Malakal as the destination. This has put pressure on all our services, both in the children's hospital and also in the adults hospital in the POC. And this means MSF has to adjust its activities. We had to create a completely unique team to be in the Bulukat entry point with the complete mobile clinic, with the complete healthcare team to be able to serve the increasing population of returnees. We have seen more than 150,000 people pass through Bulukat Transit Center, and also we have seen demographic change in the population in the town, and at the time it was only 10% of the host population. In the last few weeks we see that has changed to 40% of the host population, which continues to have an impact in the healthcare. We also want to appeal to the donor community not to forget the conflict in Sudan. We know it has been enveloped by other conflicts in Gaza and in Ukraine, and we think a big conflict is happening just next door to where we are, and we should continue to talk about it to ensure that this population does not get forgotten.
Yes, my name is Monica Genya, and I'm the Association and Board Support Director for Doctors Without Borders.
Monica, can you describe the current living conditions at the Renk and Bulukat transit centers?
Yes, the situation is absolutely dire. We have a lot of people who have been crossing the border from Sudan into South Sudan since the war in Sudan started in April 2023. We've estimated around 680,000 people have crossed the border. They're seeking safety. They're trying to move through South Sudan to neighboring countries like Kenya or Uganda. But as you know, the situation itself in South Sudan is not conducive for people traveling through. So they're now centered around Renk and Bulukat in the thousands.
Specific challenges are the MSF teams facing while providing aid at the border crossings?
So we've seen a lot of people come through who are malnourished and malnourished children especially. Coming through with a lot of health issues. So MSF is providing at least primary health care, vaccinations, trying to treat the malnourished children. But there's a massive need for a lot more humanitarian aid, especially in the transit centers, but in the whole of South Sudan as a whole.
What kind of international response is needed to effectively address this crisis?
No, we need a massive scale-up in humanitarian assistance from all over the globe. South Sudan has not had it easy for the past few decades, and it's now gotten intolerable. And the whole world has to turn its attention to South Sudan now and help before it gets much worse than it is.
Individuals and organizations contribute to the MSF's efforts in South Sudan?
Absolutely. We are looking for support. We're looking for other aid organizations to come and join, and for individuals to support us, to come and support us in any way that they can. They just come to our website, www.msf.org.za, and support our effort in any way.